So I think the academic year day is very important to the faculty of medicine and health sciences because it is the one day that showcases the good work that is done by our researchers and our academics in our faculty. So the academic day is now in its 57th year this year, and we are very excited that it's grown from a very meager beginnings where there were only 10 presentations, and now we are now having something like more than 350 presentations this year. But not only the number that's exciting, I think also for me is the scope of research that is being shown is quite exciting. So as you know, traditionally this faculty has focused on infectious diseases, but now there's much more variety with including mental health research and including research on health system strengthening and even medical education research that has now come up in the last few years. So we're quite excited about the diversity of research and also about the interdisciplinary nature of the research. So having a lot more faculties involved where people do research across the disciplines, and also within the faculty having basic scientists and clinicians coming together to do the research. So it is really a wonderful collaboration and a showcase of the good work that people are doing this year. One of the particular strengths of Academic Day is that researchers that are young share the platform with researchers that are old. So we particularly interested in young researchers, master's students, post-masters like PhD or postdocs, sharing research and presenting their research on the same platform as established researchers that have been doing this for many years. And this is a wonderful way to make the young people feel more comfortable so that they can go out and present research also around the world after this.
So my research team is busy with evaluating new drugs for tuberculosis, which is a big problem here in the area in South Africa and especially in Cape Town. And there have been several new drugs coming out recently that we have all been fortunate enough to get our hands on to test them here in Cape Town. And some of them do look very promising. We have in the last years been able to develop new methods to test them, to be able to get to new regimens that we can bring to our patients more quickly. And most recently, we've had the success that the first of the new TB drugs has now been registered with the Federal Drug Administration in America, mainly based on data that we actually could collect here in Cape Town at Stellenbosch University. From the more scientific side, I am going to show in my presentation a tentative new method how we could perhaps become even faster in evaluating the value of new TB drug regimens with a method that one of my PhD students and my research team have recently developed.
Okay, in my lecture I will be discussing research in functional brain imaging performed in the faculty over the last decade or so in social anxiety disorder. Social anxiety disorder is one of the commonest serious anxiety disorders, but we don't have a very good understanding yet of what causes it. We understand most anxiety on a neurological level in terms of what we call fear conditioning, and it was with this in mind that we set out on performing these imaging studies using a technique called SPECT, which is an abbreviation for single photon emission computed tomography. It is a way of looking at what is happening functionally inside the brains of people, rather than looking at the structure of the brain. And as the studies were performed and results came in, we found that some of the findings were unexpected. And it was the result of this that we started to rethink what our findings meant and started at the same time to realize that they may reflect changes in what we call social cognition, the way we think about our social interaction with others, and the way possibly even in which we interpret some forms of non-verbal communication. And it is on the basis of this that we're starting to develop new hypotheses on what may in fact cause social anxiety disorder.
The focus of my talk at the annual academic day will be understanding rural clinical learning spaces, looking at students being and becoming. Medical education has seen significant innovation over the past couple of years. Much has been written about medical education for the future and health professions in the 21st century. Implementing innovations has become commonplace in a number of medical schools or health professions faculty. Implementing innovations, however, places a significant responsibility on the institutions that are implementing them. We need to be responsive both to the students, to the staff who are involved in the innovation, and indeed to the community if such an intervention is in the community. One example is the Ukwanda Rural Clinical School that was established in 2011, with 8 students being the first group to enter this new terrain. At the start of 2011, we commenced with a longitudinal study so that we could track and monitor, evaluate, and just understand the experiences of the students who would go through this process. What I'll be reporting on in the presentation covers the first 2 years of the study. We are now in year 3. Our analysis in year 1 was really part of a benchmark or a formative evaluation. And that exposed us to what the students were thinking, what their experiences were. We conducted thematic content analysis of a series of interviews that were conducted with students, with clinician educators, with key role players, as well as community care workers. What we found from that was that students were predominantly experiencing something different to the Tygerberg experience. In year 2, we expanded the study. So we not only repeated what we'd done in year 1 by again interviewing the rural clinical school students, but we also moved out to where the students from year 1 who were now graduated and were working as interns in hospitals across the country. We expanded the study to include them again and to hear, as they reflected back from their internship role to the rural clinical school experience, what further lessons they had learned and what we could learn from this process. We hope that this research will not only provide insights as to the experience of the rural clinical school, but will also provide spaces for us here at Tygerberg to reflect on what we are doing here, to reflect on the learning experiences that our students are having, and to consider how we might take this forward.